Good morning. It's Thursday, July 2nd, and I have to tell you the truth. If it wasn't for the rants, and if it wasn't for the Zoom, I wouldn't know which day it is. So that's how I'm keeping my calendar straight. Anyhow, today I have a story to tell you about our healthcare system. And it deals with the coronavirus testing. But this is a reflection on our entire healthcare. Now, this story took place in Texas. This couple was going on a camping trip. They were going to spend 13 days in close quarters with 3 other friends. So, on the way to the camping trip, they decided that they were going to get coronavirus tests. So they go for drive-through tests at the Austin Emergency Center in Austin. And the center advertises a minimally invasive testing experience. Both of them didn't agree that this was a minimally invasive test. They both said it was very uncomfortable to have the long nasal swab pushed all the way into their nose. And one of them's eyes teared up, and the other one thought the swab was going to go into his brain. But the test came back the same way. They were negative, but the accompanying bills were quite different. And this is the point I'm trying to make. The young man who paid in cash was charged $199. The young lady who paid with insurance was charged $6,408. The young lady said, "I assumed like an idiot it would be cheaper if I used my insurance card, and I better pay in cash right there. My bill was 32 times the cost of what my friend paid for the same exact thing." It didn't end there, because she got her insurance to negotiate the bill down to $1,128, and the plan said she had to pay $928. Okay, that was a little better, but not great. So this couple and several other couples shared their experiences with the newspaper, and their experiences offer a rare window into the unpredictable way health prices vary for patients who seemingly get identical care. How much variation can there be when somebody is sticking a nasal swab up your nose? So within the group that we're talking about right now, 3 people paid with insurance and 1 paid with cash. And after negotiations between the insurers and the emergency room, the total that the patients and their insurers ended up paying varied by 2,700%. That's a lot of money. That means that the insurance companies have different deals, the cash has different deals. It's really a shanda. It's just a shanda. When you take a good hard look at it, there is a fundamental fact that sticks out. The fact is that in the United States healthcare system, the government does not regulate healthcare prices. There is, however, a common procedural technology, the CPT coding system. These are numbers that identify the procedures that a doctor may perform. And within the charts that are kept by the government and the insurance company, there are different pricing ranges for each CPT code. So the range might be from $1,000 to $2,000. And if the doctor charges somewhere in that range, then there's not going to be a real problem. And then, of course, the doctors can combine several different codes, which are basically there's a couple of different procedures linked together, and that will come up with a different set of prices. So there is some pricing control, but it's not very, very specific. And I know all of this because I ran health insurance for my company for 5 years. Another big part of the deal here is the deals that hospitals and doctors make with insurance companies. The insurance companies may have a special deal with any hospital where they are going to accept a certain amount of money for a certain code, one of the CPT codes. The same thing for a doctor. The doctor can make a deal with an insurance company and he's going to charge them. Because when you look at the bills that you receive, the amount of money that the insurance company gives to the doctor or the hospital is not what they were billed. They were billed X according to the code, But then the insurance company has a deal that says, I don't pay X, I pay 50% of X. And in many cases, you might be responsible as the insuree. You may be responsible to pay that bill. And sometimes you're not. So it's a very, how shall I say, it's a mishmash. Insurance is a mishmash. Now, the Trump administration did take measures to kind of standardize the pricing on the coronavirus testing, but it didn't really work out that well because many emergency rooms and hospitals, they add certain fees on. So it came out as in the example we're talking about that the person who paid cash paid a lot less than the person who went to the insurance company. And there are many cases where the doctor does something. He draws your blood and does some other things, but then he sends the blood sample to a laboratory, and they add a whole bunch of different charges on it depending upon what the doctor told them to do or what they think they should do. In one of the examples that we talked about with the swab, that swab was sent out to a lab to do final testing on it, and they were supposed to test for coronavirus only. But instead, they tested for a half a dozen other diseases and added all that onto the bill. But nobody asked them to do that. But if you're not paying attention, you end up paying that money. And another thing you have to watch out for, the dreaded out-of-network syndrome. You go to a doctor, he says we got to have some surgery. They bring in an anesthesiologist. You don't know this guy, but they bring him in. He's out of network. He doesn't take your insurance, and bingo, you got a big bill. So we, as people, are very lax. None of us shops for our health insurance properly. Everybody's got some health insurance deal. Maybe they got it through the company or something, but they retire. When you retire, you don't shop for it. You're content. You pay the premiums and everything, and that's a disaster. Anyhow, the end result of the woman who was charged $6,408 ended up paying nothing because she went to a local TV station and complained, and that solved the problem. But there should not have been a problem in the first place. The minute this thing started with the testing and everything, the price should have been set right there. We got these stations, you're paying $50, you're paying $25, you're paying $100, whatever the price should have been, it should have been settled right away. And that's the problem with our healthcare system. We have no control. The government does not take any control over this situation. Bottom line, we need a better healthcare system. Trump has promised one. We're waiting. Okay, I'll see you in the morning. Bye.